Hi, everybody. This is Melissa Murray speaking, giving you a little bit of general information for orientation. We are really looking forward to your arrival in our department. Okay, so in this talk, we are going to go over some general information, a little bit of the pathology department overview, and then a little bit of information that's more specific to the surgical pathology fellows. So orientation will be held on July 1st. In the morning, you've been assigned different activities by the GME office. We have been told that you should be finished with those activities by 12:30. So we would like you to come to the pathology department at 12:30 on July 1st. Take the C elevators to the 5th floor, which is the main entrance for pathology. We will be providing you with a box lunch. We will escort you to your desks. At that time, some of our IT people will be there to assist with your logons to the computer systems. We'll give a little bit of a tour of the department, and then we will get you working right away. So on Thursday, July 2nd, the expectation is that you will come in the morning to look at the biopsies and prepare them for sign out. You will have a sign out with your attendings. Now, in this time of COVID, we are still doing social distance sign out. So it may be a variety of options, and you'll just discuss, I'll explain more when you get here, and you'll discuss it directly with the attendings that you're assigned to sit with. Also in the morning on July 2nd, though, you have been given a time to go for your N95 mask fit testing. So if you are in a sign out, you'll have to step away from that for a few minutes. The attendings have already been made aware, and it shouldn't be a problem. So patient and confidentiality. So I think this is fairly self-explanatory, and I expect that the GME has a section on this in their general fellowship orientation. But so all efforts should be taken to protect the privacy of patient information here. You know, you need to keep the reports and the slides together. It's not that common that you'll be traveling in the elevator with cases, but if you do, you need to make sure that the pages are flipped over so patient's information is not visible to other people in the elevator. You need to also know that you cannot put any patient information on a mobile device. So you cannot use a USB and take patient information. When you put a USB into our system, it will require you to encrypt it with a password. And if you do that, then you are able to store some information on a mobile device. But you need to be really careful with it. If you were to lose that USB, you need to report it to us and let us know. You know, a lot of the basic information that I know you already know from working in the medical field for so long. So communication with clinicians. It's not uncommon that the clinicians are going to contact you to find out the status of a case or a preliminary diagnosis. So in some circumstances, it's appropriate for you to engage in a discussion of the pathologic findings with the clinician. If the case is signed out, then that's the official report, and you can give that information to one of the doctors. But if the case is not signed out, it's probably best to let them know that you're going to communicate with the attending who is assigned to the case and decide what should be said. But and sometimes you can't find the attending. It is appropriate to let them know where you are in working up the case, but you just really need to make it clear that this is preliminary information because the case is not signed out, and that they should not take it as the final report. Something can change between preliminary diagnosis and the final diagnosis. And if you have a question or you're unsure, it's always best then to just direct the clinician to the attending. Quality assurance. So we have a QA team here in the Department of Pathology. You know, we want to minimize any events, especially events that involve fellows. You are absolutely free to bring to our attention anything QA that you have come across, a mislabeled specimen, a mislabeled slide. You know, if an incident has happened that you've been involved in, you're not sure if you switched some tissue, you know, let us know. The information is confidential. We have an excellent QA team, you know, and we will work through it. And just a little reminders, you know, please make sure when you are working with the slides and paperwork that you are double checking patient identifiers, right? Making sure that those slides match the patient's, the requisition, the specimen requisition. If you're in the gross room, then it matches the label on the gross container. Please make sure to always double check and make sure you're working on the correct patient. When you open up a case in COPATH, make sure it's the correct patient's name for the slides that you are looking at, you know, and that you didn't accidentally scan the wrong specimen requisition. So just all these things, you know, be diligent about making sure you have the right patient information in front of you. So next up is staff interactions. Again, I don't expect any issues here. All members of our department are required to maintain a professional demeanor, you know, in working with each other. We have a very open department. The attendings doors are open. I don't think you'll ever feel that people don't have time for you. Things are a little bit different now. Not as many people are in the department because of COVID and social distancing practices. If you ever have an issue with any staff in our department and you feel that someone's been unprofessional, you can certainly bring it up with me and we can talk about it. You can bring it up with the chief fellow. So please be professional to all levels of staff in our department. Okay, moonlighting. Moonlighting internally or externally is not allowed for any of the pathology fellows in the Department of Pathology. Vacations and time off policy. So for the surgical pathology fellows, vacations have been scheduled before time. You get 3 weeks of vacation and you are permitted a total of 20 days off a year. Usually those additional days are for days that you need to go interview or you may have a doctor's appointment. You need to get permission to take those other days off. So just make sure you talk to the program coordinators and email me or Dr. Katabi. For the subspecialty fellows, you talk to your program director about how you're going to go and schedule your vacation. Okay, work hour requirements. We do follow work hour requirements in New York State. There are, you know, the requirements 80 hours a week that they mandate, as well as the ACGME. You will be asked twice a year to document your work hours. And if you're having issues with scheduling, always you can bring them up with me. Okay, so chain of command. So essentially your next up is you can bring certain issues to your chief fellows who can direct it to the program directors. You are all welcome to go and discuss issues directly with your program director. We will give you phone numbers for important contacts that you need to know, especially if you're on call in the evening or on the weekend. And we're always here and available to, you know, help you with any kind of issues, a work issue, personal interaction issue that may come up. I don't expect any of this to come up, but you never know. Okay. So addressing your issues, again, the program directors are here, the program coordinators are here. Also for your own personal health, I hope that all of you find yourself a a physician for the year. You never know, you're here, you may be new to New York, make sure you get that established. We do have a lot of sort of urgent care centers around. There's one just a few blocks away from Memorial. Employee health here will not see you for like a common cold. And then other issues under personal health, stress, mental health issues. We have a very excellent program called Magellan that should have been discussed in the GME orientation, where you can get free sessions, counseling sessions if you need it for yourself, for your immediate family. They have it in a variety of ways. Even before COVID, they had it, via teleconferencing. So that is available, and that is completely anonymous, completely anonymous. I will give you the phone number for that after you get here, and you can find it on our intranet. And then evaluations. This is a little more focused for the surgical pathology fellows. At the end of each subspecialty rotation, 3-week rotation, some of our rotations are 1 week, you will be evaluated by the attendings that you interacted with, and you will also be asked to evaluate the service that you were just on. And these evaluations by the attendings, we collect them, we discuss it with you twice a year at the review meeting after the CCC, so then your mid-year review, and then at the end of the year review. Sometimes, though, I find that fellows maybe are not so sure how they're doing, or they don't feel like they've gotten, the feedback they were looking for from their attendings. You can always come to me in any time, and we can look up what your evaluations have been, or talk about any issues, or get you more sufficient feedback. Okay, so an overview of the department, right? So we have 17 SurgPath fellows. At the moment, we actually only have 16 SurgPath fellows. We have 23 to 24 subspecialty fellows, more than 90 attending staff, pathology assistants that essentially run the gross room. We have 2 autopsy assistants. We have a robust team on our Precision Pathology Biobank Center team, which we used to call the Tissue Procurement, TPS, as well as many staff under histology, clerical, digital imaging. It's a large department. Our case mix is 70% in-house cases. So these are the biopsies performed at MSK and the surgical resections, excisions that are done here. And then about 30% of the cases are what we call departmental consults. So this is where we are reviewing outside material and confirming the diagnosis. This needs to be done for all patients that come to Memorial for treatment. It's a requirement that their outside pathology be sent in to our department for re-review. A report needs to be issued before the patient can receive treatment here. So these are departmental consults, or we often refer to them as DC cases. The educational offerings that you'll see this year, so we have daily didactic subspecialty conferences, which this year will be via Zoom. Monday through Thursday, it's 11:30 to 12:30, and on Fridays, it's 12:15 to 1:15. This is your protected time. Everybody knows this. All the attendings know this. We do respect it. Sometimes we may lose track of what time it is during a sign out. So if it's getting close to 11:30 and you're not done, you need to say, hey, Dr. So-and-so, excuse me, but it's time for my lecture. And they will say, sure, no problem. Go to your lecture, and you'll make a time to re-meet after that. The surgical pathology fellows present 2 cases during the year, 2 presentations, an interesting case conference, and a journal club. A schedule for that will be forthcoming in a few weeks this summer. And the molecular fellows and subspecialty fellows participate in what we call this sort of molecular anatomic pathology conference. It's a 30-minute case presentation where the subspecialty fellow presents sort of the surgical pathology part of it, what the case is, a little bit of the history, and you pick cases that have an interesting molecular finding, and then the molecular fellow will present that part. Obviously, not obviously, but we have pathology grand rounds throughout the year. There are many interdepartmental, multidisciplinary conferences. You'll learn about those on the different teams that you are. There is a New York Path Society that has lectures throughout the year. You're invited to those lectures. You'll get emails when they're occurring. And if there's a charge to attend, the department will pay and support your attendance there. So expectation of our fellows, please be responsible and professional. We're looking for, you know, excellence in our clinical care for all of our patients here. You know, try to be confident and efficient. It's a real struggle at the beginning, but we all know that. We are patient, we will help you, and you will be fine. Okay. After your fellowship at MSK, we're already talking about the end, but really, I mean, this fellowship will give you so much experience with cancer cases, more than other practicing pathologists may have had. By the time you finish this, you will not be daunted by large volume of complex cases. You'll be able to gross any specimen you encounter, and you really, this year will be hard, but it will be amazing. So more focus for the surgical pathology fellows. So you know you have your subspecialty rotations. You have